Hi, this is Dave here from ProSport Physiotherapy, and we've had a lot of questions lately coming in through email and social media about knee problems, and we're seeing a lot of knee pain patients at the moment at ProSport Physio, and so I thought it's a good opportunity to actually put some, immediate concerns about maybe your knee pain to bed straight away. Now, if you've had a traumatic fall or you've taken a bang to your knee, usually within 48 hours, these will settle down. So the first thing I would say is don't panic. Give it 48 hours. There's going to be maybe a little bit of swelling in the knee and your body is doing its best to heal it. So, most kind of niggles and bangs settle down. That's okay. But if your pain is prolonged, then we'll just go through the knee joint now and just give you some clues as to what maybe structures may be a little bit irritated and then what we can do to fix that. So the knee joint's made up of the femur, which is your thigh bone, the tibia, which is kind of your shin bone, and then we've got a small little bone on the outside as well, your fibula. Now, the femur also is very important for, that goes up into the hip, okay? So it's an important bone for the hip joint, and the tibia is a very important bone for the ankle joint, okay? So straight away we can see the impact that possibly previous injuries may have from ankles and also hips on the knee, okay? So if you've persistent knee pain, okay, or you just developed this knee pain, there may be a problem that happened previously with the ankle or the hip or something like that, a rolled ankle, that your brain has gone, okay, well, I've got this injury, I'm going to do my best to get through it. And then what it does is it lays down these kind of patterns of movement or habits of movement, okay, short term, which is fine for the initial injury, but then things start to creep up on us and it just puts more force in different directions through different joints, okay? So there's research showing us that actually when there is pain, that the direction of the force that goes through the joint actually tends to change. Now that's very specific to you. There's no definite X equals Y. It's very, very specific to you and how your nervous system chooses to distribute the forces going through the knee. Okay, so that's why then we can have some problems with fluid in the knee, where we just put a little bit more pressure on the knee joint and the nervous system says, well, okay, I need to heal this knee now, so it's sending fluid. Now, the question on ProSport Physio that we're interested in, all our physios, is why has that fluid come in the first place? Why does the nervous system think that we need to heal this knee joint, okay? And then we can trace that back through your subjective history, okay, of maybe previous injuries, or, you've started a new sport, you've done a new activity, and maybe the loading was incorrect, or maybe too fast too soon, or something like that, okay? So we can get to the bottom of it very, very quickly by asking some very specific questions. Now, the actual knee itself, we've got a few issues that could potentially be causing your pain. So the first one, if there's fluid around the knee, okay, and if there's fluid superficial on top of the knee, usually we've got a little bursa just above the kneecap and then under the actual tendon itself. So the bursas there can sometimes get a little bit irritated, which can cause a little bit of fluid, okay. That would feel quite superficial. It'll feel like it's not in the knee. We also can have fluid inside the knee, which feels like the knee is almost full. A lot of my athletes will tell me, okay? Then that usually can be indicative that maybe something inside the knee capsule itself is a little bit irritated, okay? So that could be maybe the cartilage, or a meniscus as we like to call it, in between the two bones. Now, very often the cartilage can have little tears in it, okay? That's all normal and it's all a consequence of living our daily lives, okay? So very often I'll see scan reports and I'll see, they'll say, okay, there's a tear in the meniscus or there's a tear in the cartilage. That should not worry us to a point. We need to take all the information together and make sure that this cartilage tear, it's acute and it's significant to your symptoms and it's stopping you doing what you want to do. So when I get professional athletes scanned, the top radiographers in the country, in my opinion, are very, very good at giving you an indication of if this pathology is relevant to the clinical picture that we're seeing. Okay, so if I send a player for a scan, very often I'll almost know that he's got an old cartilage tear, okay? but it may not be significant to his presentation that the actual symptoms could be somewhere completely different in the knee, okay, or it's not acting as it traditionally would. So that's important, that actually just because you have tears in your cartilage doesn't necessarily mean you need surgery, okay. There's a lot of people walking around that probably have small little tears in their cartilage and they're absolutely pain-free, okay, and you too can be with the right treatment and the right rehabilitation approach. So that's the first thing. If you do have a cartilage tear, don't worry about it, okay, or if your scan shows it, okay. Also, if you've had a cartilage tear and you've had surgery and the pain is still the same, well then maybe that's a clue that we just still haven't found the exact driver of this pain, okay. Then the next thing that can cause problems very commonly, especially with young teenagers as well, is the patella tendon, okay. So people, you've heard this term tendonitis, where the tendon gets irritated. Now we usually these days like to call it tendinosis, where there's actually no acute trauma to the tendon, but it's just more of an irritation of maybe some slight bits of the fibers that are just degenerating a little bit. Again, wear and tear that just gets irritated. Now for younger kids, if they're loading and they're playing loads of sport, they can get what's called Untitled Chapters, where the tip of the tendon just starts to peel away a little bit from the bone there, and you just get that little irritation. Again, we can settle these symptoms very quickly using a hands-on treatment approach and giving the system what it needs in terms of rehabilitation exercises, okay. Then we've got our ligaments outside. We've got our LCL and our MCL. So when we're twisting, or if we've taken a direct trauma, sometimes these can get a little bit irritated. So if your pain is on the outside of the knee, okay. We also have on maybe the inside of the knee, if you're getting inside knee symptoms, you've got your pes anterior bursa there as well. So again, there's a little sac of fluid there. If the muscles around that area may be doing too much or too little, again, that bursa, can get a little bit irritated. Again, we can restore the recruitment and the timing of motor units, and then we can help take the pressure off that bursa very quickly, okay, with the skill sets that we've been trained in at ProSport Physio. On the outside, we could have maybe an ITB band syndrome or something like that, where there's just a little bit of irritation on the outside of the knee. Again, we just need to understand what's driving your symptoms and make this treatment and rehabilitation program very specific for you, okay. We've also then in the back, we've got our our PCL and our ACL, which it just stops the movement of the tib and fib. Now, those ligaments usually would be involved in a traumatic incident where there's a lot of twisting or turning for the ACL, okay? That usually tends to respond, from my clinical experience, with quite a bit of swelling, okay, both outside the knee, and it'll feel deep inside the knee. If you've had a traumatic experience or twisting and turning, then obviously it's pretty, it's pretty good practice to get that checked out, either with your physio or with your GP, okay? Then the other thing is the PCL. Now usually that can get a little bit of irritation when we fall on our knee, okay? So when that tibia gets kind of bashed back, the translation of the tibia to the femur just goes a little bit too much, and that PCL can get a little bit torn. There's a lot of people with PCL tears, especially in professional sport, and they don't get those repaired, okay, if we feel that they're functioning well enough again. So, if you've had this injury for a while, it's not the end of the world. Your body can heal itself and it can adapt. And, the key thing here to understand is it's very, very durable to your body, okay? So they're the major kind of structures that may get irritated with the knee. Then we just have that generic anterior knee pain, okay? Now the anterior knee pain, okay, is a generic term, and what we'd be more interested in is, why is that knee joint getting irritated? Why is there pressure on the knee? And again, we need to go back to your history, what's happened, what's your story. And once we can get your specific story, then your treatment plan becomes very, very easy to design a bespoke program for you, okay? Rather than just giving every knee pain patient the same exercises, we find that doesn't work very well, okay? Or certainly it takes a lot longer. Whereas we give your body the stimulus it needs, it can change things very quickly, okay? Then the last bit, or the last term, is arthritis of the knee. Now that's usually just the wear and tear of the articular cartilage of the surfaces of the knee joint. Again, very, very common, okay, as we go about our lives, okay? Wear and tear, it's normal, it's a part of our life, okay? what we find is that when we do some hands-on treatment to some tissues and then we give the correct stimulus to the muscles, that knee pain, that arthritis, okay, can improve drastically in terms of the symptoms. And that brings me back to this whole thing that we talk about in our blogs, is that pain is an output of the brain, okay? Pain is an interpretation from our nervous system that there's some form of pressure or irritation somewhere in the body that we need to change something, okay? And that's where ProSport Physiotherapy, we can help reassure the nervous system with our hands-on treatment, but also with our specific rehabilitation for what you need. So what we want to do is we want to give you the power to understand what's the problem, and then actually give you the exercises that you need to do to go and live your life pain-free. And all our exercises are all online as well, so you can actually check them as you're doing them for maximum effect. Now, the last part of the puzzle is this chronic knee pain, okay, or this persistent knee pain that you haven't been able to get rid of, okay, and you've tried traditional approaches. Well, we know from latest research that how the nervous system reacts with pain or nociception, which is a step before pain comes, is that it tends to go to a high threshold strategy. So it recruits bigger muscular fibers, and it tends to inhibit or shut up, so to speak, certain units of the muscle. So what we need to do then is we need to trace which motor units are inhibited, and then reassure the nervous system that it's safe for those to fire again. And that's what we do on a day-to-day basis in professional sport. From day one of an injury, we'll go about reassuring the nervous system so that those motor units don't change the recruitment order. Then we can get them to fire as part of a big team with a progressive rehabilitation program. Okay, and that doesn't take long. That may take one session, it may take 2 or 3 sessions. But what we may need to do is we may need to look at different parts of the body. Okay, so we may need to look at the hip, we may need to look at the ankle, depending on your injury history, and we may need to see how the recruitment strategy that you're using now is having an impact on the knee. And then when we usually take care of those, we find that symptoms dramatically reduce, okay? And as I said, we're trained in certain skill sets to find these, and then we tailor our treatment program specific to that. Now, the final question that I get a lot is, how do I get rid of fluid on the knee? Well, you can ice the knee for 10 minutes, okay, every hour if you wanted to, and you can do a little bit of compression. Now, there's a little bit of debate in the medical world about whether they're the best things to be doing after an injury. Now, from my experience, compression and the icing isn't going to do any harm, okay? But the most important thing is that we start to use these muscles again. Our muscles are almost like pumping systems. They work with our vascular system, they work with our lymphatics, which just helps drain that fluid. So once we can get a good contraction of muscles, that's going to help shift and pump that fluid, okay? Just like the heart pumps blood around, that's a muscle. These muscles help pump that fluid away. So that's where your initial assessment is very, very valuable, and that we can show you the exact exercises that you need depending on your symptoms and what motor units have altered in your own body, okay? And once we get them fired up, then we tend to see that muscle contraction can get a little bit better. Then that pumping of the fluid tends to get even better as well, and actually flush it away like your body can do naturally. Okay, so that's the most important thing, is actually getting the muscles working again, getting you moving again, and getting you back into functioning pain-free. Because what we don't want to do is sit down and rest for too long, because our body, our ligaments, our bones, they all need loading in order to stimulate healing. Okay, so the worst thing we could do, ice pack, compression, I'm not going to use the leg for a week or 2. We need to do a little bit of that in moderation, but we also need to get our confidence back. And that's a lot of it. What it is actually confidence in using these structures again. So if you've got any knee pain symptoms or chronic knee pain or arthritis of the knee, okay, there's a lot that we can do to help improve your symptoms, okay? And for the vast majority of people, we can get these people back living pain-free, functioning, enjoying life without any pain in these knee joints, okay? So if you'd like an assessment and you like a bespoke treatment program that takes into consideration your own story and your history, then you can contact us using the buttons and contact details below. We'd absolutely love to help you and give you the same treatment approach that we give all our patients at ProSport Physiotherapy, both amateur professional sporting athletes, but also non-sporting patients as well, because we treat all people, okay? We treat the human body rather than the title of who that person is, okay? So I look forward to seeing you soon, or one of my team look forward to welcoming you to ProSport Physiotherapy and get your life back on track again, living life pain-free without any knee pain.